Okay, Ms. Walters, so now we'll be doing your physical exam, and I'm going to be working from your head down. So starting with your head, I'm just visualizing, making sure I don't see any asymmetry, any noticeable discoloration or lumps. I'm then going to palpate throughout the scalp and the head, again making sure I don't feel any kind of bumps, lumps, any kind of tenderness. After I do that, we will just go ahead and move on to your visual fields of your eyes. So we're going to start with your snelling. I would stand 20 feet away, have you cover one of your eyes. You want to start with your right eye, perfect. And then I want you to read the line, the smallest line that you can see.
FELOPZP.
Awesome, and then you can switch and cover your other eye, and then do the same, read the smallest line that you can see.
BEFPOTEC.
Okay, very good. All right, now after that, I'm going to have you read this sentence on this piece of paper.
The quick brown fox jumps over the lazy dog.
Awesome, very good. For the near vision test. After the near vision test, we'll be doing your visual fields and testing your peripheral vision. So what I want you to do is whenever you can see my fingers, I want you to say now, okay?
Now.
Good.
Now.
Good.
Now.
Perfect. So peripheral vision is intact. After that, we are going to be doing your Hirschberg test where I'll be testing with the light. So I'm going to take a light from 12 to 15 inches back, shine, have the patient look at the light, and I'm just assessing to see that the reflection in her eyes is symmetrical, and it is. Okay. After that, we will do our cover test. So Ms. Walters, what I want you to do is focus on the door, looking away, and then I'm just going to cover one eye at a time, and then uncover, and I'm looking to see if there's any deviation in her eyes, and there is not. Okay, very good. All right, after our cover test, I'm just going to be testing your extraocular movements. So what I want you to do is just follow my finger with your eyes. Do not move your head. I'm just making sure that her eyes can follow in all directions. Perfect. Thank you, ma'am. And then we are going to just inspect the eyes, again looking for any kind of drainage, redness, asymmetry. I'm going to take a look at her conjunctiva to make sure that they are pink, and they are, so that is good. Then I'm going to take a look at her pupils. And I'm using my light to test for, you can just look straight ahead, looking for pupillary reaction, both direct and consensual. Good. Good. Okay, perfect. All right, and then we're going to do our convergence test. So Ms. Walters, what I'm going to have you do is I want you to focus on my fingers. Now focus on the door. And then back at my fingers. Good. And what we're doing is assessing to see if those pupils constrict to something more near to you. And they do, which is perfect, and dilate to something farther away. All right, after our convergence test, we would move on to the ophthalmoscope, which I do not have. So we're just going to pretend. I would start, if I'm starting with her left eye, start further back, checking for the red reflex, making sure that it's present. I would then follow that red reflex all the way in up to her eye, where I can then see the internal structures of her eye. I will be looking for the optic nerve, the fundus, and the vasculature inside, making sure I'm not seeing any hemorrhages or anything abnormal. And then I would repeat with the opposite eye, again starting from further back, checking for the red reflex, following the red reflex all the way in, and then assessing the internal structures. Very good. All right, now we're going to move down to the ears. We're just going to start by assessing the ears, making sure that they're symmetrical, checking the placement, which they are in line with the outer canthus of the eyes, which is normal. Then we will palpate, feeling for any kind of lumps, bumps, or tenderness. And then give a little tug. Any pain?
No.
Good.
No.
Perfect. Then from there we would use our otoscope to look at the internal structures of the ear. Again, I don't have one of those, so we'll be simulating again. But on her left side, take my right hand and pull the pinna up and back, and then using my otoscope to look inside at her tympanic membrane. While I'm assessing the tympanic membrane, I'm looking for the pearly gray color. I'm looking for the cone of light to be at the, let's see, 5 o'clock on the right side, 7 o'clock on the left. Do the same thing over here, making sure I don't see any perforations, bulging, redness, drainage. Very good. And then lastly for the ears, we'll be doing our whisper test. So I'm just going to come to the side over here, and Miss Walters, whatever you hear me say, I want you to repeat it.
Daydream. Daydream.
Very good. Come back to the other side.
99.
Very good. Then we'll move further down the face. I want to go ahead and palpate the sinuses. So I'm just going to feel for any kind of tenderness or pressure in the frontal and maxillary sinuses. Feel any pressure?
No.
Okay, very good. Then I'm also going to palpate the nose, just feeling for the bony structure at the top, moving into the soft tissue at the bottom. And then after that, I would also take a look inside of her nose at her internal structures. I'll take my light, just pull those nares upwards to assess the turbinates, and I'm making sure that those turbinates are a dark pink, moist, not boggy or gray, no polyps or obstructions. And then after the nose, we'll move on to the mouth. Again, looking for symmetry on the outside, and then I'll be taking a look on the inside. You'll open up. And on the inside, I'm just looking to see that the mucosa is moist, everything is uniform, no redness, ulcerations, that the tongue doesn't have any kind of patches. If you'll just lift your tongue up, I'll look on the underside. Good. And then if you'll stick your tongue out and say ah.
Ah.
Perfect. And that way I can see the structures in the back of the throat, making sure that that uvula is midline and appropriately raises whenever you say ah, which it does, so that looks great. Now we are going to palpate your lymph nodes, checking for any adenopathies. So I'll start at the preauricular nodes and palpate with the pads of my fingers, making sure we're not feeling any hard fixed lymph nodes. Good. Down the neck here. Supraclavicular nodes. And underneath the clavicle. Good. And the nodes behind the occipitus. And down. Wonderful. Very good. All right. Now, Ms. Walters, we're going to move on to your respiratory exam. So we always start with just inspection. I'm just looking at the chest. I would be looking for any kind of course, discoloration, cyanosis, lumps, bumps, anything abnormal, not uniform. Making sure I see that chest rise and fall with her breaths, which I do. Looks wonderful. And then we will move into our auscultation. All right, and Ms. Walters, whenever you feel my stethoscope, just take a deep breath in and out for me. And now I'm going to have you turn around so I can get to the posterior part of your lungs. And I'm going to be doing the same thing. I'm just going to be auscultating. So whenever you feel my stethoscope, you just take a deep breath. Last one. Very good. All right. auscultation. I'm going to palpate the lungs. I'm first going to start with our tactile fremitus. So I'm going to be using the palm of my hands and pushing on her back. And Ms. Walters, whenever you feel my palms press against your back, I want you to say 99.
99.
Perfect.
99. 99.
Awesome. And what we're assessing for there is that we can feel the same vibrations symmetrically, that they're the same. After that, I'm going to do our expansion. So I'm just going to take my hands, sort of push in here, and have Miss Walters take a big deep breath. Wonderful. And I'm just checking to see that my hands and my thumbs separate and come back together symmetrically, which they do. All right. And now I'm going to be doing our percussion. So this we will just be feeling in between our ribs here. And we're listening for sounds of resonance across the lung fields. Good. Good. All right. Okay, Ms. Walters, if you will please turn forward facing again. Now we're going to move on to cardiovascular. So again, just assessing the chest, taking a look at it, making sure I'm not seeing anything abnormal. Then we're going to auscultate our heart sounds. Good. Good. Very good. So we'll be switching to the bell of our stethoscope here and listening again. And we are just listening to hear heart sounds S1 and S2. Making sure we're not hearing any extra heart sounds like S3 or S4 or any heart murmurs. Very good. Okay, Ms. Walters. Now I'm going to have you move over to the bed and lay down. Okay, so now we'll be checking for jugular venous distension. We would want our patient laying at a 45-degree angle from there. Paper here. Alrighty, Ms. Walters, and you lay back and then turn your head to the left. Perfect. And what I'm looking for is the highest point of pulsation of that jugular vein. And then once I find it, I would have just a straight edge and a ruler. I would take my straight edge and place it horizontally at the place of the point of the highest pulsation. And then I would take my ruler and place it vertically at the sternal notch and then measure the distance on the ruler. Perfect, thank you, ma'am. You can just relax. And then from there, I'm just gonna be checking her pulses in all of her extremities. So starting with her arms, feeling down just to feel the warmth, checking for hair distribution, making sure I'm not seeing any discoloration, feeling her radial pulse. Perfect. Brachial pulse. Very good. And then also checking her capillary refill in this extremity just by pinching on those fingernails and checking the blanching time. We want to see that those capillaries refill in under 3 seconds, color returns. So then on her other arm again, feeling for the warmth, looking at the hair distribution, feeling the radial pulse, capillary refill, and then also her brachial. down to the legs, same thing. Hair distribution, warmth, color, all of that looks good. And then we'll be doing our popliteal pulses here, which can be a little bit difficult. Oh, yeah. And this other leg. Good, very good. Then we'll move down to the dorsalis pedis pulse. Good. Posterior tibialis on both sides. Good. And then also checking the capillary refill in her lower extremities. This would also be a good time to look for any edema or swelling that we could also feel for. All right. After the cardiovascular system, we then will move on to the GI system. So Ms. Walters, if you just want to lay down flat, maybe turn for me just a little bit. Perfect. And then we're going to be taking a look at her abdomen. So we'll just pull this up, pull it down just a little bit. Starting with inspection, we're just looking at the abdomen, noting any kind of masses, lesions, discolorations, looking at the shape of the abdomen. It is normal to see peristalsis sometimes. It can also be normal to see the aorta pulsating. Her abdomen looks great. After inspection, for the abdomen, we move straight into auscultation. Down here, just be listening in each of the 4 quadrants. Good. Very good. Good. And we're just listening for the little tinkering sounds of digestion present in all quadrants. So after we auscultate, then we will percuss. So I'll be taking my finger here, percussing in each of the quadrants. And with abdominal percussion, we want to hear sounds of tympany because of the airspace within the bowels. All right, and after we percuss in each of the quadrants, then we will do our percussion for the liver. So we will start at mid-clavicular line, in line with the umbilicus, and percuss upwards. Till we hear from tympany to dullness. Mark there, and then we will stay in that mid-clavicular line, but come up above the liver and in between the ribs. Percuss downward. There we go. To assess where the liver upper border is, mark there, and then measure the distance between the upper and lower border. We want to make sure that that liver is not enlarged. Then we can also percuss to try to find the spleen. That would be on the mid-axillary line on the left side in the 10th intercostal space. We'll just feel here. 11, 10. We are again listening for that dullness. All right. After percussion, we will then palpate the abdomen. Before palpation, it's always a good idea to ask the patient if they're having any pain in any areas and palpate that area last. Are you having any pain in your abdomen?
No.
Perfect. So we'll start with light palpation. So we just take our hands, lightly feel. This helps the patient get used to the feel of your touch, get used to the feel of your fingers. Usually lets down the ease of any guarding they may have. And as long as they're not having any tenderness in any quadrant, then we move on to a deeper palpation. And here we're checking to see if we feel any masses, any stool in the bowels. And then we're also watching our patient to make sure that they're not having any type of guarding or grimacing that can indicate pain. Good. Then we will also attempt to palpate the liver. So we will go on this right side, feeling up under the ribs. Good. All right. And then take a deep breath for me. Good. Very good. And then we will also try to palpate the spleen, which in a normal finding we would not be able to palpate. But again, just on this left side, hooking up under the rib. Deep breath. Perfect. We don't feel anything. Alrighty, Miss Walters. Well, that concludes, please back up, that concludes your physical exam for today. So thank you very much for your time and your cooperation.
Thank you
You're
so
very
much.
healthy.
Thank you.